Medicare Part D rates, the monthly premium that you pay, should be doubling or tripling or even more for 2025 over 2024 prices. That is because of the pressure put on the insurance companies when they have to limit how much you can pay for your Part D drugs to $2,000. So the $2,000 cap is a great thing for people that take a lot of drugs, but it's pushing prices up all around it to compensate for that. So the insurance companies were going to raise their premiums much, much, much higher than this year. And the government, Medicare, stepped in and said, woo, that's a bad look. So they gave them a Hail Mary. They gave the insurance companies a bailout. We said, we will give you money if you promise not to raise your rates incredibly high for 2025. So if the companies participate in this demonstration project, they agreed not to raise their drug plans, their Part D drug plans, more than $35 for 2025 over their 2024 prices. They could be less, but they can't go more than $35. So naturally, the insurance companies are like, hell yeah, this is a great deal, right? We're going to get a subsidy. We keep the prices low. Clients happy. It's awesome. Well, the Senate Finance Committee looked at it and said, not so fast. They said this thing was rushed through, this bailout for the insurance companies, and it didn't go through the normal procedures where there's a period for public comment and congressional inquiry. Just go rush through. They never told us how much it's going to cost the American taxpayer, which is going to be a lot. We know that. And they did it differently than they've done demonstration projects in the past. So why? What was different? Why did you have to do this? Now, the fact that the Senate Finance Committee opened this inquiry, we don't know what's going to happen. Because normally, in a normal year, I would already see what the prices are going to look like. I can't tell you, I can't talk to people until October 1st, but I would see them in July and August and September. Nobody has seen anything because the insurance companies have to keep rebidding. They don't know what they're doing. And now they thought they had this great subsidy so they could lower their prices. And now the subsidy might be going away and they might have to raise them back up again. And this is all right before the time when you will get notified what your plan changes are. By law, if you have a Medicare Part D plan or a Medicare Advantage plan, your insurance company has to give you an annual notice of change in the month of September. That's the law. Then starting October 1st, we independent insurance brokers and the insurance companies can talk to you about the changes for next year. October 15th, you can change your plan. It won't go into effect until January 1st. So that's the natural flow of events, which is completely disrupted because of this $2,000 cap impacting the insurance companies. The government saying, oh, this is a very bad look in an election year, trying to prop up the insurance companies, keep down the rates, and then another arm of the government saying, wait, we don't know what's going to happen. Stay tuned, because eventually, if it's not this year, and maybe not next year, eventually, this $2,000 cap on Medicare Part D prescription drugs is going to cause your Medicare Part D monthly premium to double or triple or worse. Like I said, they're artificially pushing it back, but eventually that market force is coming to bear and you are going to feel it. Not the good news I'd like to give, but I'm telling it to you straight. Thanks for tuning in. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.